David Greene, CEO of the Florida Pain Network, where we connect those in pain with pain relievers around the state, including Florida pain clinics, Florida chiropractors, and physical therapy practices. Today I want to talk to you about 5 ways that pain doctors and chiropractors beat sciatica. So when you have sciatica, which is when the sciatic nerve, and let's pretend my finger is a sciatic nerve, is being pinched. So let's say this is a disc herniation and is pinching it, and that sparks up inflammation around the nerve being pinched. And that causes sciatica pain to shoot down wherever that pain innervates. So it might be the side of the thigh, it might be the back of the thigh and the back of the calf going all the way into the foot, but it is really uncomfortable. It can cause cramping, spasms, numbness, pain, tingling. It can be a big problem. It can cause problems with work, socializing, playing with your kids, walking, driving. It can be a pain, literally and figuratively. So, what are the 5 ways? The first one is medications. Medications may simply be over the counter that can help, and that would include anti-inflammatories like ibuprofen, maybe some Tylenol, okay? There's a big anti-inflammatory that pain doctors or any doctor can prescribe called a Medrol dose pack, and that's a big dose of prednisone that then tapers down over the next 3 days. And that can decrease the inflammation that's encasing that nerve root for a couple weeks, potentially, a few days to a few weeks. So other medications include narcotic medications such as opiates. Those can be very helpful. And then muscle relaxers. A lot of time when you have that inflammation and sciatica, it can cause muscle spasms, and that can lead to a lot of pain and continues over the course of the day. And the muscle relaxer like Valium or Scalaxin can really bring that down. So the combination of medications can be a great head start. That's number 1. What's number 2? Number 2 is physical therapy. Physical therapy for sciatica can really help take some pressure off of the nerve root by some of the things that they can do, such as stretching, strengthening. Electrical stimulation can be very helpful at decreasing spasms, and they can bring the pain down. All right? The next one will be chiropractic treatment. Now, 12% of the population at any one point in time is under the care of a chiropractor. And the satisfaction with chiropractic treatment has been shown to be 85 to 87%. So a large part of the population does it, 12%, and almost 90% of those are very happy. And sciatica is very well taken care of by a chiropractor. The manipulations that they can do, a lot of the strengthening and stretching exercises under the care of a chiropractor can be helpful with alleviating that pain. Okay? So that's number 3. What's number 4? Number 4 is injections. And that would be epidural steroid injections predominantly. So what that entails is, like I said, steroid injections around where the nerve is being compressed or pinched and causing the inflammation. And it bathes that nerve root with soothing medication to decrease inflammation and bring the sciatica pain down. A lot of times you need 1, 2, 3 injections, a whole series of them, and then that can be repeated every few months. But the effectiveness of these injections is well over 75%. So the 5th treatment is spinal decompression therapy. And that treatment was FDA cleared back in the late 1990s, and it's grown in popularity because it works very well. It works well for degenerative disc disease, spinal arthritis called facet arthritis, spinal stenosis, failed spine surgery, and sciatica pain. It can really decompress the area that's being pinched and give nice pain relief. Well, how well does it work? Spinal decompression therapy has been shown in numerous studies to be over 85% effective for alleviating sciatica pain. Okay? So there you have the 5 treatments. What is actually happening though with these treatments is not curing the problem. It's not taking the piece of disc that's pushing on the nerve root and bringing it away. It's just putting a big band-aid on the pain basically, which can be very helpful because what the body can do, and it often does this, is it disintegrates this piece of disc that's pushing on the nerve root. And it can pull away and disintegrate, and then the nerve root's happy again, and the pain goes away, and you've avoided surgery. Okay? So seeking treatment with a pain management doctor can relieve pain over 90% of the time. And when it does that, you can avoid surgery and the risks that go along with it. Okay? So check out the Florida Pain Network at floridapainnetwork.com. you'd like to see a pain doctor, just click on I Need a Pain Doctor, and the closest ones to you will show up right there. Or just call us at 877-877-8556. I'm David Greene, CEO of the Florida Pain Network. Your pain stops here.